Many have dreams to be a medical professional. When choosing an institution for medical school, a lot of things matter. The quality of the academic and clinical programs, as well as the clinical experience. At UNIMAS, we offer that and more. A supportive culture, a vibrant community, diverse student and patient population, all set against the backdrop of Kuching and Kota Samarahan.
The culture here is welcoming. It is a big family. Everyone wants the next person to succeed together. We want our students to reflect back to the society and the community today. As a community-driven university, we believe that immersing themselves and ourselves in the diversity, it creates better innovation and greater creative achievement.
In UNIMAS, there's not a culture of a competition here, but a great environment is what we all strive for.
Everyone is committed to create a great environment to become a great doctor in the future.
Our patient population in Malaysia is remarkably diverse. Different languages and dialects will be something that we face every day once we become a doctor. So, getting to know this and learn it now make us to be more appreciate and respect. It just set us up to become a better doctor for the future.
From the beginning of the program, 25 years ago, we have adopted a spiral curriculum. As the students advance forward into their years of clinical study, we connect everything back to underlying basic biological sciences. We connect and revisit every aspect of human health, from emotions to diseases, back to its basic biological sciences.
We are introduced to clinical setting early in our curriculum. The exposure gets more as we advance through the year. It was very daunting at first, as a first-year student, to step into hospital and seeing patients. But at the same time, it's really an exciting experience.
We are committed to excel in nursing education, research, and practice. It views health as a complex and dynamic, and the client as a holistic individual. Students in this program learn in an environment that stimulates intellectual inquiry and creativity, which encourages them to be problem solvers and lifelong learners.
Here, we learn how to care, to serve, and to help. We went from zero to hero.
I really cannot pick a better place to learn and become a greatness. This is a place that belongs to my heart throughout my journey.
Come do research with us.
Come and join us at UNIMAS and realize your dreams.
Assalamualaikum, salam sejahtera, selamat pagi, and salam UNIMAS tersayang. Very good morning to all of you. First of all, I would like to introduce myself. My name is Mama Shukran bin Kana. You can call me Shukran. I'm a Community Development Officer at the Department of Psychological Medicine, Faculty of Medical and Health Sciences, Universiti Malaysia Sarawak. For today, actually, I feel very grateful because this is my first time, my first ever, and my first appearance in official online forum like this. Thank you to the organizer, Corporate and Publication Unit, Faculty of Medicine and Health Sciences, and UNIMAS for giving me this chance. So for today, we will having a fifth Health Talk series for 2022, which will presented by our department, Department of Psychological Medicine, FMHS, UNIMAS. Our topic for today Health Talk is I don't want to meet people. Dalam bahasa English, I don't want to meet people. Kalau bahasa Melayu, saya tak nak jumpa orang. Kalau dalam bahasa Melayu Sarawak, kami si mau jumpa kita. Jadi, for this kind of topic, Of course, our topic is in English. We also allow our audience to share any opinion, question in bahasa Melayu, our national language. Boleh, tak ada masalah, no problem. Before we start, now let's go over to our next agenda, which is who is going to be our speaker for today's talk. Of course, for information, this talk will be a purely talk, no slideshow. Kalau ada slideshow from our panel pun, there will be a very minimal slideshow. Our input is more to the forum, to the live talk. Our expert to discuss this topic today is, again, before I introduce our speaker, I believe that most of you out there will be very impressive to both of them. A young, beautiful, talented, and smart lady. And what is very important, they are expert in their own field. So our first speaker is Dr. Amanda Albert. Dr. Amanda, hi, how are you? Please.
Hi, good, Encik Sukran. Thank you for such a sparkling introduction.
So I will read up your data. Dr. Amanda Albert is a psychiatrist and lecturer in the Faculty of Medicine and Health Sciences, UNIMAS. She worked with others as healthcare workers to promote good mental health and treat mental illness. Her interests include mental health awareness among religious groups, the impact of exercise on mental health, as well as environmental conservation, environmentalist, and animal welfare. Itu sedikit banyak biodata Dr. Amanda. And our next speaker is Dr. Chen Yok Yong. Hi, Dr. Chen.
Hi, thank you very much, Encik Sukran.
In our department, we call her Dr. Wawai. Yeah. Dr. Wawai. Dr. Wawai is a lecturer in the Faculty of Medicine and Health Sciences at UC Malaysia Sarawak. She provides her services as clinical psychologist. She is CP, clinical psychologist, at a couple of local hospitals in Kuching area. She brings a compassionate commitment to whole person care for people with mental health needs. She has clinical experience in the assessment and implementation of therapeutic intervention with children and adults. She believes that psychotherapy can help individuals most effectively use on resources to increase self-awareness, to improve our own skills, and to create path to the life they want. Before we start the discussion, I would like to bring a situation or sample case which is related to our topic today. I will read it in bahasa Melayu. Saya mempunyai seorang adik lelaki yang berusia 25 tahun. Umur 25 tahun. Dia merupakan seorang pelajar yang cemerlang, pintar dalam akademik sejak sekolah sehinggalah ke peringkat universiti. Walau bagaimanapun, adik saya mempunyai beberapa sikap seperti berikut. Yang pertama, adik saya ini tak mahu berjumpa dengan orang. Bila ada tetamu datang ke rumah, dia akan cepat-cepat masuk ke bilik. Mungkin ada di kalangan kita yang berhadapan dengan situasi beginilah. Takut untuk keluar rumah, membawa kereta, motosikal ataupun jogging kerana takut sesat. Bila keluar, tak jumpa jalan pulang. Sesat. Dia takut. Yang ketiga, tak mahu bekerja. Duduk saja di rumah, makan tidur, mungkin main gadget, online 24 jam. Yang keempat, kurang bercakap. Mungkin tak nak bercakap pun ada juga. Dan yang terakhir sekali, dunia ini hanya dengan laptop saja, dengan gadget saja. Mungkin juga ini disebabkan dia merupakan seorang graduan dalam bidang sains komputer. That's why dia sangat rapat dengan gadget lah. So keadaan ini telah menyebabkan mak saya menjadi risau. Orang tua risau lah. Kenapa tak nak bekerja, tak nak jumpa orang? Adakah sikap adik saya ini normal? Atau dia mempunyai masalah gangguan mental. So, untuk membicarakan dengan lebih lanjut lagi berkenaan dengan our topic today, I don't want to meet people. Kami semua jumpa kita. Saya tak nak jumpa awak. So, we start with Dr. Amanda, Dr. A. Actually, Doktor, what is social anxiety disorder? Ataupun dalam bahasa Melayunya kita panggil gangguan kebimbangan sosial. Over to you, Dr. A.
Right. Thanks, Encik Sukran. So, I think that's a question that everybody is asking. Mungkin bila Encik Sukran bagi senario itu, kita sendiri ada mengalaminya ataupun kita ada experience orang lain. Kita tahu, kita kenal orang lain yang mengalami sedemikianlah. So, for some who do experience social anxiety, memang mungkin tak sampai jadi graduan pun. Compared, if you think about the scenario that Encik Sukran bagi, because a lot of them will have trouble even before that. So first, let's break down the meaning of the words. What actually is social anxiety disorder? So social will be the opposite of being alone lah. Social meaning our interactions with the people around us. Dia antonym kepada bersendirian. Bersendirian, antonymnya adalah social. Okay. Anxiety tu, kalau ada siapa-siapa di sini, if anyone of you here has experienced anxiety, it probably you have an idea of what it feels like, kan? Berdebar-debar, tunggu nak buat presentation, right? So anxiety means somebody who feels anxious, will be worried, banyak berfikir, banyak risau, okay? They will experience a lot of bodily feelings, okay? So your heart beating fast, your head is getting dizzy, rasa nak pengsan, rasa nak muntah, right? Your stomach hurts, okay? All these things come together when you feel anxious, okay? So somebody who has social anxiety will experience all these things, anxiety, when faced with a social situation, okay? So nama-lama kan, social anxiety ni adalah social phobia, you know. So it's formally known as social phobia, and it's the type of anxiety, right, where people, somebody who experiences social anxiety disorder is very fearful or avoid scenarios that they can be closely observed by people. You see, the main fear here is somebody is watching you closely and somebody is going to judge you negatively. Okay, so some examples include giving a speech, giving a presentation. Okay, for some people, even makan minum depan orang pun memang rasa anxious lah. Okay, eating or drinking in front of others, starting a conversation with unfamiliar people because they worry that they will be judged for what they say, right? So the main content, right, the fikiran yang sentiasa adalah, okay, di dalam fikiran individu ini adalah saya risau akan dihakimi orang lain. Saya risau orang lihat saya buat kerja, lihat saya bagi presentation, lepas tu dia menghakimi saya. Okay, so if of course some of these situations you cannot escape kan, takkanlah seumur hidup nak makan seorang diri, tak ada bagi presentation langsung, right? So if they have to go through it, they will endure it with very intense fear and anxiety. So it's important to remember that many of us, just like many of us will feel down sometimes, it doesn't mean we have depression. In the same way, many of us can have temporary fear. Kadang-kadang we rasa anxious, temporary social anxiety. We fear meeting other people. We fear giving presentations. But somebody with social anxiety disorder will have a fear that is berlebih-lebih, that is out of proportion to the actual threat. Okay, for example, the actual threat meaning, okay, maybe I don't do so well for this presentation, kurang markah. But this person's fear, they fear that the examiner will judge them, will stop them from continuing in their program. Then they fear that all their friends will stop being friends with them. You know, this is the kind of huge fear, much bigger than the actual situation. Yeah, so it's very, very big. It's a very big fear. And then it will continue for a long time, sometimes beyond 6 months, okay? Often beyond 6 months. So in psychiatry or psychology, when we use the word disorder, it usually means that it's very big and out of proportion to the actual situation. It lasts for a long time and is different from the person's previous state. So kalau ada perubahan dari diri dia yang dahulu, lepas tu sekarang ada perubahan, that's when we call it a disorder. So many of us can have social anxiety, but for it to become a social anxiety disorder, we need to fulfill certain criteria lah kiranya. So if you imagine kan, social anxiety will make somebody's life actually quite difficult. Kan, their life and relationships can be quite difficult.
So meaning that doktor, bukannya dalam masa 1 bulan tu kita ada rasa risau, ada takut nak berjumpa orang, terus dicop sebagai SAD, social anxiety.
Well, if kalau rasa takut tu memang berlebihan, sangat-sangat luar biasa berbanding dengan personality ataupun behavior orang tu terdahulu, then you may still consider social anxiety lah. You may still consider that.
Early stage lah doktor.
Yeah. Tapi untreated, memang it will persist. A lot of the social anxiety is not like, the normal one that comes and goes. It can persist even beyond 6 months.
Okay, thank you, Dr. A, Dr. Amanda. This is our kickstart lah for today. So we move to our next panel, Dr. YY. Are you ready?
Yeah. Ready
So,
for the
Dr. YY,
questions?
are social anxiety and introvert the same? Adakah those yang ada social anxiety ni orang yang sama, orang yang mempunyai perwatakan introvert? What do you, Doctor?
Yeah, thank you, Encik Shukran, your soalan, yeah. A lot of people will mix and they will think that social anxiety and introvert atau mereka bagi label like pendiam is the same, but actually they are not the same. Okay. So, of like this social anxiety, individual with social anxiety, they will think that a lot of people will think that these people with social anxiety is very introvert. They are shy. They don't want to talk with other people. They don't like to go to a crowded place. But actually, social anxiety, like what Dr. Amanda was sharing just now, and also in scenario yang Encik Sukran yang kongsi tadi, is actually they don't like to go out. They don't want to participate in this social activity. It's not because of just pendiam atau shy sahaja. Bukan as simple as that. They sometimes they are not shy and they are not timid, but they have extensive, intense feeling of fear, ketakutan tu, kebimbangan, kerisauan tu yang besar-besar. And because of them feeling such intense feeling of anxiety, anxious and worries, even sometimes that they themselves do not know what make them so worried. What that make them so feeling in danger. They sometimes they know that, hey, my anxiety, my that intense feeling is not valid. They know. Sebenarnya saya tahu tak patut tak perlu saya rasa macam ni. That out of their control, out of their willingness, they feel this fear. They have this anxiety and they have these worries. And these have affected their daily functioning. So a lot of these individuals with social anxiety, deep in their heart, they want to socialize. They want to have friends. They want to talk with other people. They want to go out with friends. They want to eat together. But ketakutan ni, kebimbangan ni, kerisauan ni, halang mereka buat sesuatu. Halang mereka buat semua aktiviti ni yang mereka nak enjoy. Because they have an intense feeling of fear of being judged, like what Dr. Amanda said, fear of people don't like us. Or sometimes mereka takut, mereka tak suka segan. Mereka nak avoid segan, nak kurangkan kesegangan tu. So they will choose to run away, to avoid, to involve in this kind of activities. So they have the temporary relief. But do they actually happy? Do they actually want it? Maybe not. So in the other way, like what Encik Sukrin tadi cakap kan, pendiam atau kita panggil introvert. Mereka introvert is a kind of personality, is a characteristic. Orang yang introvert, mereka suka diam, they like to be staying alone with themselves. This is another way we call it solitude. Yeah, doesn't mean that they can't go out. Doesn't mean that they can't communicate and socialize with other people. If there is a situation that they need to socialize, they need to communicate with others, they actually can do it quite well. A lot of them, they can do it very, very good. Although sometimes they may have a little bit of anxious, like what Dr. Amanda tadi cakap, kan semua kita orang ada bimbang, ada risau, ada rasa not very easy when we have to meet new people or in the unfamiliar situation. It's quite normal, yeah? But people with introvert, they're also the same. But when they want to, they really, really want to, they can do it. And slowly can ease it. So you can see there are quite big difference between those who have social anxiety and those who are introvert. I hope this answers your question, Encik Sukran, or Dr. Amanda.
Yeah, so it's really, I think it's really good that Dr. Chen tells us the difference. Because even in our live chat, somebody has mentioned that I'm an introvert. And I guess they wonder whether they have social anxiety or not, right? Yeah. Somebody ever once said also that being an introvert, you get an idea of whether you're introvert or an extrovert based on where you get your energy. If you're the kind of person for whom, I feel tired, I feel down, but I go to a party and I feel energized again. You know, I go to a party, I feel recharged, then it's quite likely that you're an extrovert. If you feel like, I need to spend the time alone at home, read a book, listen to music, then maybe you're an introvert. And a lot of people are a mix of both, an ambivert, they call it.
Yes.
Right? So it is important to know that it's quite different from social anxiety disorder.
Okay, thank you, Dr. Chen, and also thank you to Dr. Amanda. Ada add-on sikit tadi. So we move to our next question is to Dr. Amanda. When does social anxiety disorder start, and for how long does it last?
Right. Yeah. So this is one of the mental health disorders that is a bit different from some others in that the onset is often in childhood and early adolescence. So you often find that people experience these symptoms even from the childhood and early adolescent days, early teenage years. Okay, many will actually report their first symptoms before the age of 20 years old. Right. But the only difference is that for some people, it takes a long time to seek help. So the first time they've experienced symptoms is before 20 years old. But in some cases, right, up to 15, 20 years later only, then they realize, okay, I perlu cari bantuan, I need some help. So a lot of people actually have the symptoms very early in life. For some people, it starts gradually, slowly over time. For some people, it happens after somebody experiences something, a very stressful social situation. Contohnya, perlu bagi speech tapi dia stress sampai dia muntah. And then lepas itu, memang some individuals akan mengalami social anxiety disorder lepas tu. Tapi for some individuals, tak ada apa-apa, tak ada trigger apa-apa. Cuma dia slowly, gradually, dia develop symptoms lah.
Tiba-tiba rasa nak pergi toilet, tak?
Ya, tapi kalau itu memang boleh, tapi that's quite normal lah for some people kan. Tiba-tiba nak pergi toilet memang rasa stress kan. But what happens after that? Kalau lepas tu memang tak boleh bagi presentation lagi. Memang stress sampai tak boleh bagi presentation, then we consider, could we be dealing with social anxiety disorder or not? But for some people, they look back at it, they buat lawak lah, then they say, okay, they have no problem with presentation after that. Because they say, last time, first time aku bagi presentation, I asyik nak pergi toilet. And then they look back and laugh. Then they have because of that experience, they have less fear of giving presentation after. Then in an individual like this, you probably don't have something like social anxiety disorder lah. Yeah, so itulah, it can last a lifetime if it's not treated.
Yeah.
So it's important to get help as soon as we can lah. We will also find that in clinical settings, maksudnya di hospital dan di klinik, yang kita banyak lihat adalah lelaki. Even though actually dari segi kajian data, perempuan lebih kerap mengalami social anxiety disorder daripada lelaki. Tapi bila kita lihat di hospital setting, sebenarnya lelaki yang banyak datang. So our theory, the researchers' theory is that maybe symptoms ni adalah lebih ketara untuk lelaki. So it's affecting men's life. You know, like in our society, we expect the men to jadi leader, to speak up.
Berani, very brave.
Kena berani, kena brave. You have to be brave to speak up. You know, you have to lead the way, macam tu.
The
So
gender role, right?
yes, gender roles in our society. So I think social anxiety disorder becomes more stressful for men in our society. Sebab tu we find that we find that more men come to see us for social anxiety disorder.
Or maybe women will seek find the other way. They don't want to go to clinic. They maybe more comfort to share with their own group.
Yes, and for women, you know, you remember in primary school, you see that the girls will go to toilet together. Nak pergi toilet, pergi sama-sama, right? Women generally go to things together. So then that maybe will reduce the social anxiety. For men, it's, you know, I want to be independent, you know, kena macho and things like that. That kind of gender role, that kind of thinking. So that's why social anxiety disorder becomes very, very stressful, especially for men.
So it's also related to gender lah.
Yeah.
Different expectation.
Perempuan lain, lelaki lain, dia punya expectation.
Yes.
Okay. So next, this question goes to both of you lah. Kanak-kanak, children. A child can also diagnose with social anxiety. Adakah kanak-kanak boleh kita diagnose this kind of SAD?
Yeah, I may lead first, and then maybe Dr. Amanda can cover me up without anything. Yeah. So for children, they may have social anxiety as well. They can be diagnosed as social anxiety as well. But the way that the children express this social anxiety is a bit different from adults, or even teenagers. So yang budak-budak ia akan nangis, mengamuk. Sometimes they will complain that they have stomach ache, they have muscle tense, or they will shivering or shaking, and then nampak dia macam tak nak pisah dengan ibu ayah atau tak nak pisah dengan orang dewasa. So these are also will consider as social anxiety, And of course, in our anxiety among children, they have the one more dominant one is called separation anxiety.
Separation anxiety.
Yeah, it's also part of this social anxiety because they have those thoughts. You know, social anxiety, they have all this thought. I tak tahu bagaimana nak socialize dengan kawan-kawan, and I feel so tense and the fear. But bagi budak, mereka susah nak label, nak express this kind of feeling. And some of them, they may not understand this is anxiety as well. So they will through this crying, tantrums, freezing, or refuse to talk. Sometimes some of the children, they refuse to talk, to tell anything. They're just quiet or hide themselves in the room and doesn't want to go out. So bagi budak, memang ada have the possibilities that they have social anxiety as well. Yeah.
Okay. Thank you.
And I think, and I think after this COVID-19, these children with this social anxiety and withdrawing and doesn't want to socialize with other people, it has increased. Yes, increased the case. So now in our clinics or hospital, we can see that more and more school refusal cases coming out. And we talked about these school refusal cases. They actually have a lot of anxious and fear. And when we try to explore what is the trigger, apa yang menyebabkan mereka tak nak pergi sekolah, is they have a lot of reasons, but the main reason is because of fear, takut. And this is rooted from like they do not have the opportunity to train their social skill. They do not know how to friend. They do not know, how to follow those social rules and hint. So that make them really find it very uneasy to go to school. And all these are part of this social anxiety. Yep.
Yeah. Yeah, I completely agree. In fact, kalau kita tengok kajian di for example the United States, bila masa lockdown when COVID started, everything was online, so the students all went online. And when they open up and they gave options, bagi option lah dengan student, whether you want to go to school or you want to stay at home online. In our minds, we think, oh, sure, the kids will be like rushing to go back to school. But actually, quite a number have said no, and the numbers that are actually opting out of going to school are much higher than the researchers expect. So this could be the fact that we are dealing with a lot of social anxiety, and in fact COVID-19 has been very comforting for people who have social anxiety because you can just stay in the house and don't meet anybody. And as somebody mentioned that they feel drained when they're surrounded by a lot of people in the Facebook talk. In the YouTube live chat. So that can be a normal experience. That can be a sign that you're an introvert, but it kind of depends on whether you can. If you had to go for a social setting that you can't avoid, how are you coping? How are you feeling? If you're having a lot of difficulty, you could have social anxiety. If not, if you can find a way to cope, then maybe it's just a normal part of introversion for you. So we find this COVID has been strangely comforting for people who have social anxiety. Memang rasa selesa lah. Tapi now that everything is opening up, then we find all the feelings of anxiety are coming up again for a lot of people who have had a rather peaceful time these 2 years.
I think this COVID in general is actually heightened everyone's, not only individual with social anxiety. It's actually everyone's anxieties. We are quite, easily feel anxious and worries. So like what Dr. Amanda, totally agree with what Dr. Amanda was sharing just now. The numbers has been increased, because of all this. And of course they find it like quite comforting when they have online classes and do not need to meet other people. But this year, the more that they're not practicing their social anxiety, when everything is lift up, like the MCO have lifted, and they will ask to go and socialize, but then they have lacking of that, macam the skill rusty dah. Dan lagi dah takut.
That's right.
Is it because of the guardian or the parent, too protective to their children? Okay, jangan keluar dulu, jangan jumpa orang ini dulu, and then you must just duduk di rumah, jangan jumpa orang. Is this contribute to the factor among children?
This could be one of the reasons. This could be one of the reasons where the contributing factors or the cause. Kalau nak tanya kenapa ada social anxiety, apa yang cause dia, how the parent raise a child, not only like during COVID time or even no COVID time. Kalau ibu yang sangat protective or extremely, they will like always comment or being very judgmental, or very controlling. This type of educating or parenting, of course, is a higher risk for the children or adolescent to develop into social anxiety, and this is one of. There is also other causes, like for example, like I think there are genetic causes as well. If there are family members who have this social anxiety history, it doesn't mean that mereka mesti ada, tapi they are at a higher risk lah.
And
then Anything to add on to that, Amanda?
Yeah. So I think they do find that if you have a family member with social anxiety disorder, you are 6 to 7 times more likely to have social anxiety disorder yourself. There are a few theories to it. One is genetics. Sometimes you get certain character traits, certain characters, and certain like fear of negative comments by others. Some people are more fearful than others. So these kind of traits can be inherited, okay, from
they
your.
cannot accept the criticism.
Yeah. So you see that different people respond to criticism differently. Part of it is because of how you learn in life, your life experience. But part of it is also genetics, like how you are generally. Research does find that some of these things you can inherit from your parents. So that's one way. The other one is behavior modeling. So children learn what their parents, how they behave, and the children learn from there. So that's only part of the reason. Of course, children can have certain traits that they never inherited from their parents, and it just happens in them. That can happen too. So it's a bit hard to say. Yeah.
Add on to what Dr. Amanda was saying, we also cannot deny that if these children or this group of children, they have like experience of certain kind of trauma or bullying or ignorance or rejections or even teasing. So it may also contribute to this social anxiety as well, because of them having this so-called quite stressful experiences in the past. It may also contribute to this social anxiety. Yeah.
This links on to a topic that Dr. Chen and I are quite passionate about adverse childhood experiences.
Yes.
Yeah, ACEs lah. You will hear if you listen to mental health talks, right? People say ACEs, ACES, adverse childhood experiences. So there's a whole list of things that happen in a child's childhood, even if it doesn't directly affect them. For example, parents arguing in the home, mental illness in the home, even if it doesn't affect the child. These are all experiences that can make it more likely for a child to develop, and not just an anxiety disorder, but any sort of mental health disorder on the road. Yeah.
Okay, thank you, Dr. A. Thank you, Dr. Y, for the kind input to us. I mean, just now, Dr. Y mentioned about the separation anxiety among the children. That's the point that we want to ambil daripada the diagnosis of the children with the social anxiety. We move to the next section. Maybe can Dr. Chen and Dr. Amanda share, are there any SAD case that you handled in clinic or in hospital previously, or maybe currently, that you want to share with us as for our talk today?
Me first?
Yeah.
Okay. So maybe I can talk more about children and adolescents, and that I can talk about adults. Yeah. So yeah, like I shared just now, a lot more sometimes when children or teenagers they have social anxiety disorders, and they're trying, then the way that they manifest or the way that they present themselves is they don't want to go to school, they don't want to talk, they want to hide themselves, or they always play with their gadgets. So what makes the parents bring them to us is only until the extent like when they really tak nak pergi sekolah. Memang dah 24 hours in the phone. Baru ibu ayah risau, panik, rasa marah, then baru bawa ibu ayah anak-anak tu kepada kita. So this is a thing here. So a lot of our parents may not, recognize or may not know that actually all these behaviors, tak nak pergi sekolah, main phone, hide themselves, is actually a safety behavior for our child who has experienced a very intense feeling of fear and anxiety. So mereka anggap ini masalah lain. Then when we talk about baru sedar actually it's not about the gadget, it's not about apa tu di sekolah, but more to like the feeling of fear. So is what I notice here a lot in our clinic. And of course, like the just have shared after this COVID lagi lah, bagaimana nak komunikasi kan, nak share dengan orang lain, yang ini tidak tambah lagi perasaan takut tu kepada kita. I think this is what I observe in our clinics and hospital.
Ya, sebab masa PKP dulu, most of the children, most of the people duduk banyak masa di rumah, and then benda tu dah kita kata vacuum, dah terlalu lama terpendam dalam rumah. Bila mereka keluar, and then dia macam boleh dikatakan jadi time bomb juga lah kepada kepada society kita. This is what maybe Dr. Amanda want to share.
So okay, by virtue of the fact that a psychiatrist is a doctor who may prescribe medication, a lot of patients will tend to come and see Dr. Chen first as a clinical psychologist before they will come and see me lah. In fact, in Western countries, when you like in Malaysia, you still have to see a doctor before you see a clinical psychologist in the government setting. But in Western countries, you may even opt to just go in to see a government clinical psychologist before you see a psychiatrist, right? So a lot will present to a psychologist for talking therapy first. And then they come to me. So sometimes the patients that come to me usually have had social anxiety for a very long time that now has resulted in, for example, depression. And the depression is what leads them to come to me. And as I get a little bit more of a story, I find out that they've actually had social anxiety for really quite some time already. So it's a very severe social anxiety causing reduced work performance, causing them to lose their job, leading to depression. And that's when they come and see me. Another example will be a student who has like a lot of difficulty attending lectures, too stressful. Okay, even attending lectures, not even giving a presentation, just being around a lot of people. Very, very stressed out, and then they come in with an alcohol problem. They learn to use just the right amount of alcohol to be able to attend lectures, but to not be drunk. So they test, they try and test, and then they find a way to cope. So they've been coping with alcohol, trying to go through their studies with alcohol or even other drugs, and So when they come to me, usually they're a little bit worried about something else already, like depression on top of the social anxiety or alcohol use on top of the social anxiety. That's kind of how it presents for a lot of adults to a psychiatric service lah.
Are there any case those students yang the final year problem to defend the Viva? This first baru tak ada tak yang macam tu?
But probably before dia orang sampai tahap Viva, mereka sudah sedar memang ada problem dengan presentation semua tu. Social anxiety tu memang sudah nampak even before the Viva lah. So it's hopefully people will come and seek help before they reach the Viva stage. Because by then it will be like tahap crisis already, and then it will be like much harder to get control of that.
To affect their result.
I think this is the reason why we have today's talk, so that they are aware of all this before they come to the crisis. They already start to man.
That's right. So somebody was there's somebody who asked on YouTube as well about how UNIMAS can influence the current education system to incorporate more anxiety management. There are quite a few organizations that are doing that at the moment. One example is Pinta Foundation. They're doing a lot of work with mental health literacy among local school teachers. The pandemic kind of put a bit of a hold on that, but I think they're planning to just get that going again. And what we do in UNIMAS, and I think even in government hospitals, psychiatric services in government hospitals, is we partner with schools to do education, not just for students, but for teachers. In fact, today, this afternoon, I am going to be speaking to a bunch of graduating teachers about about common mental health disorders lah, right? So this is what we are trying to do lah. Yeah.
Maybe we can pick a few questions from the YouTube. Mandy B. Is it because we are not prepared or low self-esteem that make us nervous, especially when we giving talk or presentation?
Yeah, definitely possible. Preparation will help. We will talk about this later actually under management as well, under how we can deal with social anxiety disorder. Yeah. So that definitely, and low self-esteem is another possibility, definitely. But for all what we are planning to do today is to give you some awareness of when I should actually seek professional help. When does it become a social anxiety disorder versus a normal social anxiety fear? I mean, a temporary fear, Yeah. Somebody has asked also about how to encourage people to go for counseling and all that. I think we can talk about that under our treatment later lah. How this is treated lah. Yeah.
Are there any case letter A and letter Y? Are there any case that referred by the school counseling at the school that this student got problem? Maybe you want to diagnose it under what? Are there any kind of case like this?
Definitely, there is like cases like this, but like I said just now, when it's only anxiety, then of course the counselor at school, they are very helpful. They are very helpful. They will try their best to understand and see what happened there. But when it's only anxiety, sometimes our because of the mental health literacy among ourselves here is still not that optimal. So they will somehow ignore it and so some ibu ayah kan macam cuba aja, saya sama juga masa you, cuba aja, you boleh, kenapa tak boleh? It's actually adding on. Adding on more fears to these anxieties. To these children and teenagers. So sebab ibu ayah yang mereka pun tak tahu nak buat apa. That's why so helpless. So ibu ayah automatically they will think of, okay, how can I help you? How to solve this problem? You boleh, all this kind of thing. But in another way, it will actually add on a bit more fear to some of our children as well. So the counselor, they are noticing this kind of problems too, and this is the reason why our UNIMAS experts, we are doing a lot of collaborations with schools and with teachers. And what Dr. Amanda will sharing later on this afternoon with the new teachers, have more awareness, and they can help us to screen and prevent this thing to be happen. I think prevention is still better than cure. Dr. Amanda.
Yeah. Agree, completely agree.
Okay, Dr. Chen, just now we mentioned a little about the COVID-19 and this SAD. Maybe you want to elaborate more lah. Does COVID-19 have any impact on social anxiety? You want to elaborate it more?
So I think like just now Dr. Amanda and I was discussing about this COVID-19. In a way, this COVID-19 memang macam friendly lah with all the social anxieties, individual with this social anxiety disorder, because they help them to temporarily avoid all the situations and activities that they have quite intense feeling. But now we cannot have MCO for the whole life, right? So I think when it's lifted and all this, the basic anxiety and all this, it makes them, they need to face the reality and this on to their social anxiety. But one I want to add on here that we haven't discussed previous in early time here is because of this, macam COVID-19 ni semua tak bagus, semua bad impact, bad influence. I think most of in our mental health professions, we notice that I said on the behalf lah. We also notice that because of this COVID-19, mental health become more acceptable by our society and our public. So they seem to be like knowing that, okay, there are mental health issue. I think it's because of the MHPSS, the helpline, all this kind of
Yes.
thing. We have a lot of news coming out
Mm.
regarding what is the aftermath of this COVID-19 or kena kurung di rumah kan. So we memang put some more focus on this mental health issue. And because of that, this mental health issue, including social anxiety, now has gained more attention from the public, which somehow, hopefully, can reduce the stigma for them and encourage them to come and seek help from us. About this COVID, a little bit of the benefits there.
Yeah. Okay. Even though COVID kata COVID kena duduk rumah, tak payah jumpa orang, tapi at the other side it also have a positive impact to the society. So again, when the government slowly lifted the stages by stages the restriction, it show that the government is doing the right thing. Slowly dia tak boleh nak 100% terus. Even now pun if we want to go to the other facility, it's option lah. If you want to use mask, but in the hospital you must use the mask if you want to go to hospital because of the health issue. That what the government do right now lah. Dr. A, are there any mental health issue that can occur together with social anxiety disorder?
We also have a question. This is in relation to this question actually. We have also a question on the YouTube live chat that an individual has told us that she has been diagnosed with both major depressive disorder and borderline personality disorder. But then she's been struggling with meeting people and making eye contact during conversations. What should I do? I think you should definitely seek help with your healthcare provider, whoever is treating you. Speak about them. You should always, if you encounter new symptoms, you should always talk to them about it and see what can be done. What can be done, we will cover later under treatment. There is also another question about any connections between having trust issues and social anxiety. There is some evidence that certain children have more a higher chance of developing social anxiety because of they may have certain character traits that are more likely. For example, somebody who inhibits their behavior a lot, behavioral inhibition, what we call it. Dia jenis yang selalu tutup, selalu halang diri dia daripada react macam tu. Behavioral inhibition, that's one. The other one is fear of negative evaluation. Macam kita cakap tadi lah, kalau kita lebih cenderung kepada kebimbangan pasal komen yang tidak positif, komen negatif dari orang lain. Ada setengah kanak-kanak yang lebih cenderung kepada tu, ada setengah-setengah kanak-kanak yang okay, right? So if you have some of these traits, that may predispose you to social anxiety. So trust issue kind of like, trust issue is a bit general. We have some of these traits that are linked to social anxiety. Does childhood bullying lead to social anxiety? Definitely possible. It can be one of the triggering factors for somebody to have social anxiety, and it is definitely one of the adverse childhood experiences that we mentioned just now, that will predispose somebody to getting social anxiety, even if it's later on in life. Okay, so when we think about whether people come with other illnesses, other psychiatric illnesses, the answer is yes. In fact, social anxiety often starts before all these other illnesses, and then people develop, for example, other anxiety disorders like panic disorder or generalized anxiety disorder. Some people develop depression, right? What we call major depressive disorder. Like I mentioned earlier, some people develop problems with alcohol use, kan? So, semua masalah ini boleh berlaku. And then bila kita lihat balik, sebenarnya dia ada social anxiety even before that. So yes, social anxiety can actually come together with other illnesses lah, other mental health problems. And the thing is, for something like alcohol use, kan, or drug use, you may have social anxiety. You take alcohol or drugs to cope, but then reach a time that you need more and more alcohol and drugs to get the same effect. Okay, and then when you don't have that increased amount of alcohol or drugs, then you can have some withdrawal symptoms.
Yeah.
Okay, contohnya macam trembling, shaking hands, and then these withdrawal symptoms causes you to be more fearful. It increases your social fear because you are worried that people will look at you and judge you negatively, and then your hands are shaking, and then that fear is like times 10. Okay, so some of the problems can actually make the social anxiety worse.
How about those yang take the substance that
Yeah, it can. Some of these can make it worse. So depression can make your social anxiety worse. Other anxiety disorders together can make it worse. So we do encourage people to seek help sooner lah. Yeah, and another point for children, actually, social anxiety disorder may occur together with somebody who has, for example, high functioning autism. Autism where they're high functioning, they are doing very well academically, but then there's a problem with their social interaction. So they develop social anxiety disorder. That's also possible. Yeah.
And
maybe that's
a lot,
one to
yeah, and a lot of all these so-called mental health disorders, you can see that actually there's a lot of avoidance, or we call it safety behaviors. Yeah, like what Dr. Amanda was sharing, taking drugs, or what I have shared just now, not going to school. Or all this is, we can see that there's a lot of avoidance there, and of this avoidance that give them a temporary relief, oh, tak payah pergi, and then I feel better. But for a long run, for a long term, this actually is gradually will develop and to other mental health disorders. So I think this, like what answering to Injasukran's questions, is actually, a lot of time with this social anxiety is highly comorbid with other mental health disorders. Yeah.
Okay. We move to our next question. When do we need to seek help? What are the treatment available? How do we support them? When do we need to seek help? What are the treatment that available? How do we support them? Dr. Chen, Amanda?
Dr. Chen, go first.
Go first, okay.
Yeah, because it's primarily, I think they will come and see sooner before they see.
Yes. Yeah. Okay, so I go first. A lot of these social anxiety one, of course we need to do we need to do a lot of validations, and we need to acknowledge their issues there and trying to understand what happened. And of course, with understanding, acknowledging that we have what we call CBT, the golden standard for treatment. We have CBT to have is a type of therapy that will focus on your thoughts and your emotions. And while we are focusing on your thoughts and emotions, how do we change your thoughts and emotion and gradually leads to a change of behaviors. So this is one way that we can think of doing when we are using CBT to help and manage this social anxiety. Of course, may not to that extent that need CBT. We have what called social skill training as well. So some of them, they really, they want to have friends. They want to maintain friendship. They want to socialize. They want to give presentations. They want to attend classes. So we can have role play. We can have like training, how to be more assertive, how to be more look more confident, how to start conversations. Okay, all these are what we call social skill training, and cannot ignore. We have been talking for almost an hour. It's about fear. It's about that anxiety, that worries. So of course, when we have all this emotion, our muscle very tense. We may our body, our heart beats very fast, and our minds go blank. And this is the part that our individuals with social anxiety hate the most. So some kind of deep breathing exercise, relaxation exercise, mindfulness training, all this kind of relaxations, meditation, mindfulness training, helping them to deal with their emotion, to handle their physical reactions, and acknowledge and validating their own emotions. So these are some also other ways of helping and managing them. Okay, of course we have a lot of others. For example, like desensitization, mereka takut ni, so we slowly expose them. Desensitizations. We have ACT, acceptance commitment therapy. So how we accept our flaws, how we accept ourselves, and then how to bring this to a commitment, to an actions. Because deep down, what they really want, they still want to socialize with other people. And the most frequent comments or answer that I get from my patients is, I just want to be normal like my friend. I just want to be like them. Why I couldn't, This kind of helping them, managing them to work through it, and how to slowly, with small steps. It's sometimes they will think that therapy treatment is a big project and a 180-degree change. Actually, we start very small, and just starting from relaxation, it is really helped them and slowly introduce them to the cloud. This is one way of like the so-called talk therapy.
Meaning that can we pull all those yang ada SAD problem into one group, and then we will start doing the therapy.
Yeah.
Better.
I think just now what I'm saying is a bit some of the individual therapy. We also have group therapy. But this therapy have to be very careful because they're already like very scared of people kan. Kalau kita dalam group lagi, they first place they may not come. So you have to be very careful, like really choose the person, and the criteria of the individual who are eligible or who are suitable. More suitable to be included in this group therapy. It will be good. Group therapy is actually very good because they share symptoms and thoughts, and when they exchange their thoughts and their experience, and somehow they can how we make good use of this good therapy. They have this support, and another way is to normalize. Okay, you rasa sama ke? Saya rasa sama juga. Only me macam ni ke? Okay, then they are more willing to try, and they can practice among themselves. I think this is a good one.
Are there any support group for this kind of SAD now?
What group? Adakah? I think it's very
I think we are still learning how to use support groups in our part of the world compared to overseas lah. Overseas you can find support groups for anything, just about anything. But locally, there may be, but there are not any locally that I am aware of. And we are still, I don't know, getting the hang of learning how to use support groups. Yeah. I think in our local setting, yes.
Okay.
Yeah.
Maybe that I want to add on this medical side.
Yeah. So a big portion of treatment of social anxiety disorder comes down to talk therapy or psychological therapy. Yeah, that's the huge portion of it. But in some cases, actually somebody was asking about what the symptoms of anxiety are, right? The signs and symptoms of anxiety. Let me just show you before I talk about treatment. Let me just see if I can share my screen.
Slide.
Can you see this?
Boleh.
Yeah. So these are the common symptoms, right, of social anxiety. Physical symptoms, okay, feeling of the mind going blank, muscle tension, sweating, your heartbeat is fast, your stomach is upset, feel like going to the toilet, trembling, you're lightheaded, you feel you're going to faint, you're dizzy, right? You want to vomit, right? You're short of breath. So these are some of the symptoms that can be really quite distressing. So sometimes, for some patients, it's really difficult to overcome all this to be able to go for psychological therapy.
Yeah.
So there will be a small group of patients that may need a course of medication, and the medication that we prescribe are antidepressants. Antidepressants work or are the treatment of choice for both depression and for anxiety disorders, including social anxiety disorders. So some patients ada kemungkinan lah memerlukan ubat. Mungkin untuk bukan untuk jangka masa panjang, tapi for a shorter term. So some patients may need it longer, some patients may need it for just a short term, maybe 6 months to a year, and while they go for psychotherapy, psychological therapy. And then when things improve, then maybe we can start to try and reduce the medication. Yeah. So memang there is medication, but not everybody will need it.
Yeah.
Meaning that there's some patient will need the therapy and also at the same time need the medication.
Yes, yes. So all patients with social anxiety disorder need therapy, and some will need therapy and medication lah. But normally we don't give it to people who are in their early teens or children. We tend not to give it lah. But maybe in adults, maybe later teens to adulthood, we may consider giving medications to help to reduce the anxiety, to support them while they are going through this psychological therapy. Yeah.
The medication are quite important in some way that it prevents things to get worse. And then at the same time, it's like a start for these patients so that they can join the talk therapy, so all those therapies.
So bear in mind that some patients only come to see you after struggling with it for 10, 20 years. So by then, there are so many behaviors that become so automatic that to learn them again is very stressful. So that is when medication will come in to try and reduce the anxiety, to try and help to deal with that. So say if you guys are dealing with anyone that you know who has social anxiety disorder, right? But who hasn't sought treatment before, you can actually encourage them to do so. If it's somebody you know and you love, you can encourage them. One way is to actually, sometimes I tell people to be a listening ear, to listen to their problems, and to encourage them to seek help. One more thing that some people find helpful is to actually offer to accompany them to their first appointment. I teman you lah, we go together, because for somebody with social anxiety disorder to be in a new clinic, seeing a new person is just overwhelming. So they bring somebody with them. You can offer to accompany your loved one. And then whatever they learn in therapy, you also learn so that you can support them together. They learn about how to do deep breathing exercises. You as a loved one can help to support by learning it too. So that at home you can practice together, and then you can support them in this way lah. That's something I would recommend if you are you're worried about somebody who could be having social anxiety disorder.
Okay. Dr. Chen, want to add on again?
Yeah, I totally agree with what Dr. Amanda was saying. Have someone accompany them to clinic, to hospital, even sometimes at the initial stage, help them to express their symptoms, their struggle, their suffering. This can a good rapport between the clinicians and also the patient and also the family. So in treating all these kind of mental health problems, or issues or matters, it's not only doctor and patient, but it's from a biopsychosocial model, it involves like people around them as well. So in terms of medication, in terms of psychological, like just now someone has talked about self-esteem, motivations, willingness, fear, emotions, thoughts, but also do not forget about social. So friends, family members, even some religions, NGOs, even pets. I know that Amanda is a big fan of a pet.
Cat, dog.
Yes, or fish. I have one person, they really like fish. So they are part of the society, and they need, especially social anxiety is about social. So this biopsychosocial part is the one thing that we will focus on in actually when we are managing or treating or supporting individual with social anxiety. Yeah.
And then the nature also play an important role in this.
Yeah, agree with you. Sarawak have a nature, go out to forest, go out to the park, maybe start in the early morning without many people yet.
Yeah.
Right? Okay. Go have a walk first and slowly. People are not as scary. People are friendly, and this small step, it can help.
So there is there's a really good I think a really good resource online that's provided completely free. There are worksheets and there are information sheets as well for people who deal with social anxiety or people who have loved ones with social anxiety. The website, I will probably get the admin to share it a bit. The website is it's from Center for Clinical Intervention, Western Australia, right? www.cci.health.wa.gov.au or www.cci.health.wa.gov.au. I think I will get the admin to put it in the chat box for both groups, right? And you can follow these links to some really good resources on social anxiety as well, for some additional information and to learn about how you can help yourself if you are dealing with these symptoms as well.
Okay,
so I
before
put
we
it
proceed to the others, to the next question, just a few reminder. We have around 40 minutes to go, and then after this, on 11:30, we will have question and answer. Even though some question already posted in the YouTube just now. For those yang want to sign for the attendance, will be in the chat box after this at the end of the session. For the e-cert, we will provide an e-cert through email, which will ready by 7 to 10 days working hours. Dan yang nak claim for the MyCPD also, there will be a QR code to scan at the end of the talk with a few reminder. So we still have time now. So maybe we can go to the next question. How do we know we have social anxiety? Kalau for example lah, saya dalam rumah, keluar pergi ke Kubaharia contohnya, dapat detect, this kind of person ada social anxiety. Boleh tak, doktor?
I think kan, if they can go to Kubaharia and you boleh meet dia di Kubaharia, maybe social anxiety disorder tu tak sampai lagi disorder lah. Maybe they have social anxiety sebab dah keluar di Kubaharia kan. So I think most of the social anxiety one, we see other disorder more obvious.
Okay.
Amanda tadi yang dah kongsi kan, we see other social anxiety, other disorder become more obvious. Then we correct. Ada social anxiety.
Again, tahap dia jadi disorder adalah bila memang kita tak dapat menjalankan hidup seperti biasa. Anda bagi presentation, memang every time bagi presentation punyalah rasa nak mati macam tu. You know that kind of feeling that every time before presentation memang feeling very sick. For the child sampai the whole month tak nak pergi sekolah. You know that kind of when it reaches that degree of dysfunction, then we will call it social anxiety disorder lah.
I tambah sikit. So I think to be easy, they have 4D, 4 donkey, 4D.
Okay, 4D.
So distress,
Distress.
deviant, or danger. If anda nampak 4D ni, although the fear, the anxiety, have reached to this 4, like what Dr. Amanda just now have shared, really, really distressed. Memang tak boleh function lah, tak boleh sekolah, tak boleh bagi presentation, tak attend class, tak bagi kerja, okay, dysfunction, distress. Mungkin yang masih boleh buat sesuatu, but memang sangat-sangat distressed. All the time, the thoughts, the feeling is overwhelming them. That's why they need to use alcohol, they need to use cigarettes, they need to use substance, very and another one, the last one would be danger. So macam dah hack substance, it's not danger ke? Danger. So with this 4D there, and we nampak ada 4D ni, it's actually quite, it's really, really encourage, not only encourage, you must ask them to seek help.
Yeah, definitely.
What are the causes of the social anxiety actually?
Yeah, there are a variety of causes. Usually, for most illnesses, for most mental health disorders, it's not just one thing that is causing it. It's usually a combination of things. So it's different for each person. But one possibility for some, like we mentioned earlier, is genetic traits, right? If you have a first degree relative, okay, kiranya ada keturunan jugalah. Kalau kita ada first degree relative yang ada social anxiety disorder, we have a higher chance of developing social anxiety disorder also. There are some behavioral traits, like I mentioned earlier. Ada setengah kita yang lebih sensitif kepada kritikan, ada setengah yang okay saja. Okay, that may make us have a higher chance of getting social anxiety disorder. The other thing is, we mentioned earlier lah, adverse childhood experiences. Yang ini memang dia ada link dengan social anxiety disorder at a later age juga. So it's quite different from person to person, and for some people it's one big traumatic, stressful social experience yang trigger terus. But not for everybody. For some people tak ada pun one big traumatic event, tak ada. It just happens. So different for different people lah.
And also different kind of parenting that I mentioned just now. Yeah, very protective, very controlling. Or ibu ayah yang sendiri pun sangat panicky, yang sangat anxious. Because children, inilah cara dia kita express. Inilah kita perlu how we behave. So parenting this kind of environment, suasana, it will also contribute and put these children, adults, or this individual at a higher risk. Bukan cakap when Dr. Amanda and I say all this, is not saying that you have all this, that you definitely have social anxiety. Tidak. It's more to like you're putting you at the higher risk. And this is from research and what we see, this may contribute to further develop to social anxiety.
Yeah. Another interesting is for Asian society especially, in what they call collectivistic culture, meaning culture di mana kita selalu bersama-sama as one community. Compared to individualistic culture yang, okay, once I'm 18 years old, I go out from the house, I live my own life, macam tu. But our culture is a collectivistic culture, it's a community culture. So you can stay with your parents until like a much older age, and then we always worry about what other people think. Tengok makcik siapa-siapa punya family, nanti dia cakap pasal family kita and all that. That kind of collectivistic culture. One of the fears that come out is not so much fear of being observed by others, in social anxiety. Is fear of offending others. Pun ada. So dia punya content, dia punya fikiran dalam social anxiety itu adalah takut menyinggung perasaan lain, ataupun takut orang tu kecil hati.
Yeah.
Fear of offending others. So that is an interesting thought content that they have found for our culture lah, especially.
If let's say this social anxiety disorder happen to the whole family in one house, in the one for the one house, really how can we help them? Mak bapak pun sama, anak pun sama juga. Macam mana kita nak?
Straightforward family therapy.
Yeah.
If the whole family ada issue macam ni, then the whole family come to therapy lah, and then we learn
together.
Learn together, empower each others. It's not only maybe their way of communication. How to unlearn and relearn. So for the whole family. So it could do, and I think if you have heard about this called transgeneration trauma. So this is another thing that we I think when we are interested in SCE and all this kind of family, how family impact children and also individual. So generasi-generasi yang nenek moyang tu yang semasa mereka ada war, mereka have to fight. That anxiety is already there, and the nenek moyang yang pass down kepada ibu ayah atau nenek kita yang you survive, sebab we are in the collective like what the Amanda was sharing just now. We need to survive, we need to kerjasama, we need to be together so that we order to survive. And then this anxiety, then supaya kita boleh di-include dalam community. So if we individualism, we are excluded, rejected, that we feel very bad because nenek moyang kita tak boleh. Kalau kita macam tu, kita akan mati. So they have that, then slowly come out to our ibu ayah. Okay, kita mesti macam ni, macam tu, mesti respect, mesti di-accept. Then we pass down to us. Then you can see that, actually, we also trying to understand like why our parents behave in such way and how this have influenced us to have this social anxiety. So social anxiety is not social anxiety disorder is not satu reason yang menyebabkan dia macam tu. It can be different factors that contribute and put this person at risk.
Yeah. There is a question on we've received that I think I would like to address. It comes under treatment and management also lah. Someone is actually asked, sometimes I feel pressured to make small talk with others, causing me to avoid meeting people. What can I do about this? So this comes under self-help. We covered some of self-help just now. Okay. The things that you can do when you're on your own, right? One of it is actually what you will learn in therapy, also deep breathing exercises. In fact, you don't have to go to therapy to learn it. Online pun ada, right? There are a lot of tutorials even on YouTube about what deep breathing exercise is like. So many ways to learn it. Okay, deep breathing exercises, practicing deep breathing exercises to help to bring your heart rate and your breathing down. Okay, because what happens when we are anxious is our mind goes on overdrive. Okay, we think about, how are we going to escape this? I'm very stressed. My heartbeat goes up, my breathing goes up, everything goes up. So what you're doing in deep breathing is you are actually training yourself to breathe slowly and fully so that everything else has to go down. By breathing, you are slowing down your breathing and it will slow down your heart. It will slow down the racing in your mind. It will slow things down. Okay, so deep breathing exercise is very effective if it's well learned and well practiced. So you may need to, I guess, learn it with somebody who knows that, or I'm trying, if you are seeing a therapist, to learn it with your therapist. Relaxation techniques is one more thing that we talked about briefly just now. For some people, relaxation techniques is visualizing where they would like to be. Mount Santubong at 5 a.m. on Saturday morning, contohnya. Okay, for some people, it's engaging the senses. The smell of lavender immediately makes them calm down, so they'll put a bit of a small lavender spray in their bag. For some people, coffee immediately. So coffee. So you have a cup of coffee with you, right? the smell of coffee, they enjoy that. So finding out what relaxes you and learning how to use it, I think is an important one. Learning how to bring it with you in stressful situations is also important. One more technique that people with social anxiety have used is actually having a set list of conversation topics. So before they meet somebody, they have some ideas in their mind. Okay, today maybe I can talk about the WhatsApp breakdown yesterday.
Okay.
Maybe I can talk about
Weather.
what is it?
Our Malaysian like to talk about weather and food.
Yeah, or you talk about the nasi lemak
Yeah.
that I had from peanut anchovies nasi lemak last week, for example. You know, you have that sort of a few set topics that can't go wrong, and that's another strategy that people with social anxiety have actually used that to help to deal with small talk situations. So this question about small talk, that's something that you can actually practice. You have some set topics ahead of time, and that makes you a little less stressed out about it. Yeah, because you kind of know, okay, what I'm going to talk about, and I don't have to be like thinking in my head, going blank, and worry that, okay, apa nak I nak cakap lepas ni. Okay, so that's one thing lah. One part of therapy, I think, also involves like retraining your mind to focus on what's going on instead of thinking, oh, what is this person thinking about me? Or I'm pretty sure he thinks that I'm being weird, right? For example, but instead focusing your mind on, oh, this person is wearing very nice earrings. Hey, I never noticed that that this person has his eyes are two different colors. Each eye is different. For example, or something like that. This person drives a nice car, man. Focusing on what is there in that moment rather than letting your mind go on overdrive about what this person could think about you, which may not be happening at all. Yeah, so these are a few self-help techniques that people have used to try and deal with social anxiety disorder.
How about the difference between shyness and social anxiety disorder? Shyness and social
Dr. Chen?
Malu.
Yang malu.
Tempat. Tak apalah dia malu, tak best suruh dia pergi depan. Dia ni malu, tak apalah biar dia duduk dalam bilik. So it look like macam kadang-kadang kita tak apalah, biarkan dia lah dengan rasa malu dia. Kita biar macam tu saja. So maybe Dr. Chen want to.
Yeah. Yang malu, pendiam, suka dengan bersosial, yang mungkin salah satu personality. So, kalau terpaksa, kalau memang perlu ada markah, mesti untuk KPI, mereka masih boleh. Tapi bagi social anxiety, mereka tak boleh. Inilah yang the biggest difference between social anxiety disorder and shyness or introvert. Of course we have research as well. In America, again, 12% of those who say that they are shy, they are timid, 12% of them also have a social anxiety disorder. Saya cakap you are shy, you are timid, tak ertinya you memang tak ada social anxiety. No, we do not want to like exclude that, but we also find that ada 12% lah siapa yang cakap sendiri shy, timid, introvert, they ada resiko-resiko yang jadi social anxiety disorder. But to be stressed here again, yang shine tu memang is what? Kalau kita cakap biar, it's actually reinforcing the shyness. Ia ada bantu ke? One time, two time, you feel easy, you feel okay, fine, it's okay. Kalau dalam 5 bulan je, you pun takut, you pun tak kongsi, you pun tak nak, it means something else. So sometimes kita cakap biar tu mungkin tak not very helpful. So we have to be careful in that way lah. To add on?
No, actually, I think that's pretty much it. Actually, yeah, I did notice a new question though. On the on the chat. Somebody has asked us how to deal with obsessive love disorder. Okay, to begin with, obsessive love disorder is not a classified mental health condition. In the DSM-5. DSM-5 is our guidance for diagnosing mental health conditions. Okay, it is not a listed disorder in there. It is a term that is used in I don't know, online culture, pop culture, to describe being obsessively in love with somebody to the extent that you ignore their boundaries and things like that. So my question would be, how bad is this? Are we talking about a teenage crush? Like, back in the school, you spy people from far away, that kind of thing. And then malu kucing and things like that. Are we talking about that kind of obsessive love? You think about the person all day, all night in the teenage years, that kind of thing, right? Are we talking about that kind of obsessive love, which will come and go? Cinta monyet, people say, it will come and go, puppy love. Or are you talking about something that's a lot more serious, to the extent that you're stalking and that you are intruding in somebody else's boundaries? If that is the case, then we may need to look into what is causing that. If you go and see a psychologist or a psychiatrist, the question will eventually come: what is driving that? What is are we dealing with depression? You could have had a relationship breakup and you're feeling depressed, and then as a result you're obsessing over this person who has broken up with you. Is that what we're dealing with here? Are you dealing with depression or grief from losing that relationship? Is that what you're dealing with? Or are we dealing with something else? So that one is a question that is left to another day and would not be covered sufficiently in our Q&A time during this talk. But my question would be, how it's not an actual classified mental health disorder, but if you think you are experiencing some degree of obsessive love, then the question is to what extent, and whether there's anything else that we need to look at, like depression or not. And that is the kind of thing that is treatable. Yeah.
We have 20 minutes to go.
Oh,
tak salah.
No worries. Yeah. I think if there are any further questions,
maybe Dr. Chen want to share a tip how to meet people and make friends at university for those yang freshie kan, pelajar-pelajar baru, terutamanya ada di IPTA, yang baru masuk. How to meet people and make friends at university? Any tip?
Suddenly throw me this question. Yeah, I think this is a very common question, especially now newcomers, fresher, just semester 1, after this long lockdown, and a lot of coming back to school already. So how to make friends? I think number 1, do not force yourself to make friends. That you force yourself, you lagi lah tense up. When you are tense up, your minds go blank, and then you not relax. You find everything's wrong. Whatever you say is not correct. Everything you say better. You have all these kind of coming out. So I would say find yourself relaxed first. Find yourself in a very relaxed or okay kind of environment first. Find yourself, okay, I be here, I'm there. And I found this person are interested, like what Dr. Amanda was sharing just now, have a list of questions to ask if we're going to involve small talks. Have a list of questions there first, prepared, and you're sitting there is if someone approach you. Okay, someone approach you and then, hi, blah, blah, blah. Introduce yourself. And you can practice this in front of a mirror first before you go there. If you really find it very awkward, you have a preparation first. Preparation.
Do our own public speaking lah.
Good. Prepare yourself first. And then be mindful. Be mindful. Okay. Good. Sometimes how to initiate or maintain a friendship or start a conversation is not how good you can speak out. It's not how
Yeah.
good you express, but
Yeah.
be a good listener.
Yeah.
Be a good listener, make good eye contact, giving even you can't really using your words, but you're like, yes, you know, kind of actions or body language, yes, and facial expression. This is how it starts.
Yeah. Yeah. Yeah, completely agree. Completely agree. In fact, a big part of, I think, uni level age, right? It's self-discovery. I think you need to discover who you are as a person, what you like and what you don't like, what you can accept and what you cannot accept, and what is your life passion? What is your passion in life? You know, what is the thing that, okay, even if I'm not in this university, I'm not doing medical school, or I'm not doing whatever university course I'm doing, if I'm not what is your passion? And if you don't know that, then university is the time to explore, try something new and things like that. So when you know what your passion is and what your interests are, right? Even if you're a shy person or somebody who is an introvert, you can find your life passion, right? And it's not just, and joining clubs and life passions is not just for the extroverts. Okay, so if you can find that, then it's easier to find friends with the similar wavelength, to find and keep friends who have the similar wavelength or similar interests. You bond over similarities.
Yeah.
So I do really recommend, and I think in today's day and age, we are so worried about what other people think because of social media as well, right? We post on social media and we wonder how many likes we get because of TikTok and things like that. We are so caught up with people's approval that we forget to discover ourselves. Like, am I really the kind of person who likes dancing for camera? If you're not, then that's fine. That means you need to find some other life passion, right? Rather than stressing your head about thinking about how to find content that will get people to like me and get me to be popular. Find yourself, I think that's important.
Yeah.
Then you can find friends that bond over the same thing or have the same life goals as you.
I honor to this as well, you know. We have, I think most of us will agree that no one is perfect and there is individual differences. So allowing yourself to make mistakes, especially during the university life, you know, you're allowing yourself to have some mistakes, to have some colors and try out things. Of course, with your disclaimer here, try out things that is reversible. Yeah, don't try out things that is irreversible. Yeah, a disclaimer.
Yeah.
They have to be very sure and clear
Right.
here. What do I mean by reversible? So lepas you cuba, you tak boleh patang balik. Yang tu jangan cuba. Okay? And then, knowing yourself, like what Amanda said, trying to find yourself, allow yourself to learn. And the big part of learning is learning from mistakes. So you may cakap salah sesuatu, you may, you know, not behave as well as you thought you are.
Okay kan.
Dia belajar bah.
Yeah. So I give you an example. Like say in my first semester in med school, for example, I think I said yes to quite a number of things. You know, it's like yes to this, yes to that, even things that I never tried before, like this and that club. I mean, okay, not yes to this and that irreversible stuff, but the yes to this and that club. I actually tried quite a number of things I've never tried before, like different events and different clubs, and I found that I had some interest that I never knew I had. You know, so that's sort of like what we think, and I found some friends in those settings that I probably would not have found if I hadn't tried something new. So that's usually sometimes that's something we recommend lah to find yourself. Yeah.
Maybe one question for Dr. Amanda.
Yeah. Yes.
I think one of the questions I is this social anxiety can we prevent social anxiety?
I think there are some parts that are not preventable. For example, genes. Apa yang kita dapat dari segi keturunan, right? Or sometimes kebetulan at that time in our life, our parents are going through a difficult time. You know, it's not that they want you to go through difficult times also. It's just that it so happened it was a hard time for them, so it became a hard time for you as a child. These are things that we can't change. Benda macam ni tak dapat lah. Tapi there are some ways that I think the things that we can prevent are when we realize, bila kita sedar kita ada kecenderungan terhadap social anxiety disorder. Okay, if you recognize, you examine yourself and say, oh, I have the beginnings of some of these symptoms already. Then you can prevent it by practicing the opposite of what you feel like. For example, if you think, oh, I rasa I ada kecenderungan lah untuk social anxiety disorder. So memang kalau boleh kan, I 3 bulan tak jumpa orang pun okay. You have that feeling, then you say okay, but I'm a bit concerned lah. Tapi saya risau juga kalau kena kalau dia jadi macam satu disorder. So what you can do is you can actually purposely make the time to go out a few times. So that is a way you can prevent, by being aware of how you are feeling and what's happening, and trying to make some changes lah. Make some changes. Of course, learning deep breathing exercises, relaxation techniques, the set topics that I talk about, practicing them early also prevents you from developing a disorder. So it helps to control social anxiety before it becomes a disorder lah. I think that would be it.
So we come to the end of the session. Maybe Dr. Chen first want to conclude our talk today.
All right. Okay. Thank you very much, and Shukran, and then also Dr. Amanda have that good sharing of social anxiety disorders. And last word from me is, I think a lot of time we ourselves may not aware that we may have this social anxiety, and it already developed into social anxiety disorders. If you are concerned or you are not sure that you have, or you need to get help, you can cross-check with your close one and trusted person around you, and tell them, talking about it, communicate about your issues with other people. It gives you a different perspective that can help you, and it's part of prevention as well. And this is the thing, I think. And of course, welcome. I'm saying that if you think that you are still unsure, it's very welcome for you to come to us and to cross-check, and asking professionals and get professionals' helps. Yeah. Really, like the topic saying, I don't want to meet people. Actually, you don't want. And then back to Injat Shukran's the earlier. Thank you for the scenario to give us some ideas. How this social anxiety may manifest or may shows to us in real life. Yeah. Thank you very much. Thank you.
Thank you, Dr. Chen. Dr. Amanda.
Yep. Thank you everybody for the attention.
Okay, thank you, Dr. Chen and Dr. Amanda. Before we last our talk today, there's a last announcement from the organizer. Tomorrow, on 27 October, 9 to 11 a.m., there will be a 6 health talk series. 6 health talk series by the Department of Pediatric, Faculty of Medicine and Health Sciences. The topic is neonatal jaundice. Doctor, why is my baby yellow? Neonatal jaundice. Doctor, why is my baby yellow? The moderator is Associate Professor Dr. Sim Hui Ling, and the speaker, there will be 2 speakers, Professor Dr. Haji Muhammad Aminuddin, the pediatrician, and also Dr. Tan Sulin. So tomorrow there will be a 6 health talk for 27 October, 9 to 11 a.m. So I think that's all for today. Thank you again, Dr. Chen, Dr. YY, and Dr. Amanda for the very fruitful session.
Thank you.
I think this is one of the real forum lah. We only one slide from Dr. Amanda, the short that she shared just now. So I think that's all from me. Thank you very much. Thank you for those yang bertanyakan soalan. Terima kasih banyak-banyak. And then begitu juga dengan the organizer, unit komunikasi dan publication UNIMAS, Fakulti Kekuatan dan Sains Kesihatan UNIMAS, yang banyak yang memberi peluang lah kepada us, the Department of Psychological Medicine, to share the knowledge. And then maybe this is one of the good forum lah for us to take a step to prevent better than cure. I think that's all for today. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh. Bye bye.
Hi. Thank you.
Thank you. Bye bye.